I would take us all the way up from Southern Africa, where Dr. Faizo has just given us some reflection, all the way up to West Africa. And just as I introduced, just checking if Amanda Bisong, if you can be ready to do the presentation. Let me just introduce Amanda. Ms. Amanda Bisong is a policy officer at the European Center for Development Policy Management based in the Netherlands, and she's a Nigerian national. She has a background in law and a master's degree in international law and economics from the World Trade Institute in Bern. And she also has a master in international trade policy and trade law from Lund University in Sweden. She's currently also pursuing her PhD on the topic of regional migration governance with a focus on West Africa at the Institute of Development Studies, the University of Nigeria in Nsukka. So Amanda will just take us through, I'm sure, a regional dimension, because one of the things I've connected with Amanda also trying to understand her work that she did previously before she moved on to the European Center at ECOWAS. So I'm sure we will be taken through a bit of a journey in there and she will share some insights. And after that, I will ask some of our panel, some of our experts to share some reflections. Amanda, over to you. Thank you.
Hi, Patty. Thank you very much for the introduction, and thanks again for inviting me to be a panelist in this webinar. It was interesting, the last webinar we had.
Some echo in your computer.
Oops. Just mute one of the mics. Just mute one of the mics.
Maybe we are watching another video of same thing. So you have to stop something.
Can you hear me?
Now
we can hear you with a slight echo.
With an echo. I'm not sure why. Is the echo still there?
Or maybe you open two Zoom IDs. Maybe.
No, it's just one.
Okay. So then there is something, maybe video echo or something is happening.
Yeah.
Now I think it's okay now.
Is it better now? Okay, maybe I keep the video. I keep the video turned off.
I think without that headphone you can talk. It will come well. Maybe that is the problem.
Yeah. Okay.
Okay, go ahead.
So thank you again for inviting me, and I think I'll just go straight to my presentation because I've lost a few seconds there already. So looking at best practices in West Africa migration management, that's a bit difficult because, like Faisal already said, most of the borders in Africa and between African countries are shut. And so in West Africa, I think from April, the decision was made
still it is echoing. I think the headphone, if you can remove, it will be okay.
Okay.
Directly you can
you hear me?
Can
you hear me?
Yes, this is slightly better.
Okay. So the decision was made in April to shut down to close down all the borders in ECOWAS, and for the first time, we had a complete restriction of movement in the region, which kind of put a stop to free movement of people in the region. However, we still had goods that were moving freely within the region, and given the trading conditions in the region, this meant that people also had to move with these goods. So while there was a complete restriction to movement, you still had mostly truck drivers and their mates able to move with essential products or essential goods along trade and transport corridors in the region to ensure that the countries were able to get access to food supplies and access to essential access to essential goods. Also, because the region has previously experienced something similar, which of course cannot be compared to the corona pandemic, but the Ebola epidemic was quite intense in the region in 2014, 2015. And as a result of this, there was already a regional coordination response, health response, being led by the West Africa Health Organization and the West Africa CDC. As part of the lessons learned from the Ebola epidemic, they were able to come up with standard operating procedures and guidelines for to ensure movement still within the region during the event of any epidemic. So these regulations and guidelines, which were adopted in last year, in December last year, were quite useful in helping the region to adjust to the shutdown of movement and shutdown of trade as a result of the pandemic. So one thing we saw in the region was that there were identified logistics and trade corridors in the region, and so there was, of course, a flow of essential goods along these corridors. And this also created opportunities for businesses involved in e-commerce and opportunities for businesses involved in electronic financial services. Yeah, and another thing that we saw as a result of the COVID pandemic in the region was that WAHO and CDC, in coordinating their responses, were able to get essential services from one part of the region to another. So some countries in the region have had their health workers, number of health workers in these countries reduced as a result of the Ebola epidemic. So for countries like Liberia and Sierra Leone, they already had lost a significant workforce, health workforce, because of the Ebola pandemic. And so West Africa CDC and WAHO were able to engage in capacity building and also move essential health workers from some countries in the region to these countries to assist them in dealing with cases of the pandemic. Another case was Guinea-Bissau, where there was an increase in the number of infected persons as a result of increased testing. So the regional response has mostly been led by WAHO and by West Africa CDC. And what they've done also in the standard operating procedures and the guidelines that they have is to identify processes or procedures that immigration officers and customs officers can use at the border and at all entry points in the region to ensure that safety procedures, health and safety procedures are being undertaken, but to also ensure that economic activities are not stalled as a result of the restrictions. So it was kind of a combined approach, combining a public health approach with the economic approach. I think also another important part had to do with another important issue with migration management in West Africa had to do with refugees in the region, and mostly refugees that were moved to Niger as a result of the emergency transit mechanism. And these refugees now have, I mean, there are in the region. What we're seeing now is an increasing cases of social unrest, and in Niger we see that there are some unrest as a result of the presence of these refugees in Niger, when the social services are already quite constrained and are facing intense pressure. So what Marcia said about xenophobic feelings being on the rise, and also what Faisal mentioned about nationalistic tendencies, we're also seeing in several countries across the region with an emphasis on refugee communities. Now, most of the responses in the region have not made any reference to migrant workers or migrants living in these countries, especially as considering that the bulk of migration occurs within the region. I think this is a huge gap that has not been addressed yet by any of the countries in the region. So most migrants are basically left to fend for themselves, and they are not eligible to the welfare packages that are provided by the state. Hey, Paddy, are you there?
Yes, I'm here, Amanda.
Yeah.
Thank you for that reflection and that share. I was just when you compare notes between what's happening on the southern part of the continent and the western part, and I guess even those in the eastern horn of Africa would also agree, is that governments haven't taken too much of a different approach in terms of not being so inclusive in the social protection packages that they are providing to the most vulnerable. And I think it has been a core that many civil society organizations on the continent, from different levels, from the local level, the international level, as well as the regional level, that's really pushing for governments to have a different view in how they look at vulnerability, and understanding that migrants are critical. A group in here, and like Dr. Faisal had mentioned, a bottom-up approach is very important in us trying to to deal with the adverse effects on these vulnerable groups. So I think some very valid points that you bring across. I also wanted to just reflecting on the fact that as Ebola was leaving the West African region, COVID was coming in, and there are some lessons that that could have been picked up even much more strongly, if one would say, since the Ebola pandemic had just been ending at the time, or even eradicated in some of the countries. So we did have some space to learn of how to handle our health systems, but how to look at vulnerability in a wider scale. Even though some of these lessons in terms of how Ebola was managed from a health crisis perspective have been used, obviously, in other areas within managing COVID as a health crisis.